everybody, it's Andrea Tooley, and I'm here with Corey Springman, Dr. Springman,
Hello.
One of my good friends from residency, and we have the video that you've all been waiting for today. It's going to be great. So before we get started, as always, leave all your comments below. We'll try to answer them as best you can. I'll have Corey answer some as well. Don't forget to check out my blog, AndreaTooley.com, if you have any questions. And you can find me on Instagram and Twitter. All those links are on my channel. Subscribe so you never miss a video. And let's get started. So, Corey, why don't you just introduce yourself to everyone so they know what you're like?
Will do. I'm Dr. Corey Springman from South Carolina. I am the one resident who did nursing school before I went into medical school. And so I'm here at Mayo for anesthesia residency with Andrea.
Yeah. So you were a nurse before you went to medical school.
I was, definitely. I went straight into undergrad, into a bachelor program. It was a great program. Main reason I chose nursing was not that I really had an interest in healthcare, but more it was a good job, benefits, and it had the ability to grow with a master's program and the versatility of many different opportunities for working, like work schedules and masters again, and or PhD, or even administrative type positions.
Okay, sure. So how long was your schooling process to get your nursing degree at the beginning?
So I did a bachelor's degree in nursing. You can do ADNs, which is an associate degree, but so I went ahead and did the 4 years because in order to advance in nursing, you need a bachelor's degree. So it was just 4 years for me, and it was good.
It was good. Did you work as a nurse?
I did work as a nurse. I worked through nursing school. And nursing school is it's different than medical school because you're doing your clinicals as well as your didactics at the same time. It's kind of a lot more pressure. You don't have near as much time to dedicate to one or the other. You really have to work-life balance. And
wow.
So after nursing school, I went straight into a cardiothoracic ICU. I worked there for about a month when I got a little restless. I had been in education, of course, my entire life, and I hit a downtime. All I was doing was working 36 hours a week, and for me, that was not enough to keep me occupied.
Right.
And I had always contemplated going to CRNA school for nurse anesthetist or some other program, but had thought of medical school, but never said it out loud to anyone.
Okay.
And I was in the OR one day with a anesthesiologist and was shadowing, or part of my orientation was to see a cardiac bypass surgery. So
cool.
I got to talk with him a lot. He was my brain to pick that day. And so I asked him, if he was in my position, because at the time I had no debt. I was single, and I had my bachelor's degree, and I said, what would you do knowing the circumstances of the anesthesia if you would do CRNA school versus med school?
Okay.
And he absolutely just said med school because he just loved what he did so much.
Okay. All right. Why do you think that you had never said medical school as an option out loud? Because I think that there's a lot of people in your position who go to nursing and in the back of their head think, maybe I want to be a doctor, but never really, fully jump into that.
So I came from a good family, middle class. No one in my family was in medicine. So it was never that I was told that you couldn't be a doctor. It was just that I thought they weren't really in my cards. And so that's the only real reason. I think I just underestimated myself and my abilities.
Sure.
But I did well in nursing school, and I liked it a lot. And so that kind of gave me the confidence to contemplate the option.
Right. Okay. And so once you made that decision to go to medical school, what next? How did you even get started? Because it's a long road.
It's a very long road. So what I did, so I had only worked a month, which is crazy, to make this decision. So the next day I went and met with my undergrad advisors because they were in the same city, and they told me, what I needed to do in order to go to medical school, which requires some pre-med requisites. However, I went to a medical school that does not require requisites. I went to the Medical University of South Carolina.
Oh.
So there are a few schools out there that don't require you to take the physics, the organic chemistries, or basic biologies. You've had some of these classes if you do nursing, but it's not the whatever 101 or
right.
that they're looking for to fill these requirements. And
Okay.
so I did sign up for one physics class, and so I worked doing a little bit of physics, and so I worked 3 days a week, and then I did physics 2 days a week.
Wow.
And then I kind of had delayed really getting into it until the following spring. And then I was like, I've got to get into this. So I signed up for a Kaplan course,
Okay.
which I would recommend to anyone.
Yeah, because that was my next question. How in the world did you take the Mcat without all these classes?
Exactly. And so the Mcat, the schools that don't require you to have these prerequisites make sense, because in order to do well on the Mcat, you have to understand the subject material.
Right.
So if you understand the subject material, great, and you don't have to spend the money or the time getting all of these other classes.
Okay.
So I did the Kaplan course, and I underestimated the MCAT. So I crammed for it in a short amount of time, and was working 3 nights a week, and so I was switching back and forth.
Gosh.
So I ended up retaking the course, because you can retake it if you want to, or at least that was the option then.
That's right.
And I expanded it over a longer amount of time.
Okay.
And I really focused on the material and had the time to, because I didn't do like the summer crash course for MCATs.
Right.
And I would recommend, if you take the MCAT, take it in the early months of the year, January, February, because that's when the least amount of people take it. And so
this tip is gold.
the least amount of people take it, so your bell curve is not with all the people who are in undergrad and they've had all these courses, they understand everything, and they've been preparing for the MCAT for a long time. So that's what I did. And then so I took the MCAT. I didn't get a stellar score. Actually, I got just slightly below the average, but because of my experience being not a traditional student, it really set me apart. But
Sure.
I mean, this was not some easy feat, just to say, oh, I took a Kaplan course and I worked and I did all these things.
Yeah.
I mean, I worked in the CTICU, and then I went to the cath lab, which had a lot of versatility, more day shifts, and then I could go at night. So, I mean, I was working 4 and 5 days a week. I was on call, and then I was driving 2 nights a week to Greenville, South Carolina, so an hour each way, for about 3 hours of course each night, or that,
right.
Tuesdays and Thursdays, and then driving back. And then every bit of my time was spent on studying. And my vocabulary was limited to, no, I'm studying. When people would ask me if I could do anything with that, because that was I wanted to go to medical school, I had set this goal, and I was going to make it. So.
I'm just so impressed. So, I mean, I don't think many people could do that. I think it's really unusual to even score close to the average on the MCAT without all of those classes. So you must have really worked your tail off.
I did.
That's amazing.
It was hard, but
yeah,
it was worth it.
Okay, so you got into medical school. Did you only apply to South Carolina then? Because
I did. So in South Carolina, when I started school, there was the University of South Carolina, then the Medical University of South Carolina.
Okay.
So I knew I wanted to stay in South Carolina because my family was there, and then also MUSC, where I went, was such a big staple in the state for healthcare, and worked with a lot of physicians there, and it was in Charleston, so it's also amazing.
Yeah.
But, so I had actually transferred and started working there as a nurse before I applied. I moved to MUSC, started working as a nurse, applied, had my interview in November, and so it was the only school I applied to.
Okay.
And because of my nursing experience and everything, they really told me in the interviews, there are people up here that are going to get in, there are people down here that aren't going to get in.
Right.
And you fall somewhere in the middle.
Okay.
So you have to bring to the table, anything that can increase your points to get in. And so this would be volunteering, work experiences,
right.
Anything you can think of to just show how dedicated you are to medicine. Many people apply and don't get in, but they want to see the dedication that you're going to continue after this, no matter how many times you were told no.
Mm-hmm.
But for me, I got in the first year. And so when I got my acceptance letter, it was amazing. I was able to focus on work. I worked a lot. I took some vacations.
Yeah.
And then I started med school.
Wow. Okay. And so what was med school like, coming from a nursing background?
So coming from going into a job and working a job, and then going into being a student again, it was an amazing transition. When you're an employee, your performance is not based on you alone. Whereas when you're a student, everything that you do it will reflect in your grades. Mm-hmm. So it was so nice to go to medical school and start over. I had so much fun. It really filled in a lot of the gaps that I missed as a nurse, because you learn on the macro level and it's the micro level that you miss out on. But for me, the first test we had was in all the genetics and DNA and all of this stuff that I had never had. So everyone's coasting by the first few months.
Right.
And it was my hardest. Right. It was my hardest.
Okay. Wow.
But it was totally doable. I did well. I did fine. And, things just kept, after that first block, everything was fine. I would say that would be the only area that you have a deficit going to nursing school versus going through the traditional route.
Okay. What do you think just about like the teaching style or the level of intensity or difficulty of med school versus nursing school? Are they about the same or are they different?
I would say it's different because, when you're in medical school, your job, I guess I took it differently. I had a job before, and so here I am now becoming a student, and so my job became to learn.
Yes.
Which was what I wanted to do all along, so I loved it, and I didn't mind studying, and I felt like it was easier. So when I say that it's not necessarily easier, it's just that when I was in nursing school, I was getting up so I had class on Monday, Wednesday, Fridays, and I had tests on any of those days. It wasn't like you have a set test in medical school.
Okay.
When you get, so in medical school, you get your layout typically, and mine was every 6 weeks. Every 5 or 6 weeks, we had a test, and we had the week off of lecture before we had our test. So,
oh my gosh, go to her school.
So we had the week off, but we just had one big test every 5 or 6 weeks, of about 250 to 300 questions. So it was really more preparing you for the stamina of taking your boards.
Right.
So in that regards, it was nice. I mean, if I wanted to take the day off and not study, I didn't have to. If I didn't want to go to class, I didn't have to. Mm-hmm. But with nursing, when you have the didactics Monday, Wednesday, Friday, and then I had to get up at 5 a.m. and go to be a nurse, as a nursing student, and that goes from 6 a.m. till 2, maybe 3, then you get out of there and you're having to study for your test, and then on Monday, Wednesday, Fridays, you're going and you're pre-rounding on your patients that you have the next day. So essentially you're in the hospital 5 days a week, and you're doing studying, and I worked on the weekends.
Okay, so just way more rigorous. And it sounds like medical school worked for you because I think you're someone who has a lot of self-discipline in general. Like, when you need to study and when you can take a break, and so like having the freedom to do it how you wanted worked for you. Maybe it wouldn't have worked. I feel like that might not have worked for other people.
Maybe not. And I don't know that I would say that I'm very self-disciplined, but I know that I want to do well. I've never failed a test, but I've never been like amazing in my academic grades either. I just always knew. My fear was when I went to medical school, oh my God, if anyone fails, it's going to be me, because I'm not coming with all of these other, education and knowledge that the other kids were coming with. But you could do it, and anyone can do it. It's just devoting the time to it.
Okay. How did you get over those self-doubts and those fears? Because I know that lots of people have all of those doubts, and just like your doubts about, can I even go to medical school? Is that in the cards for me? How do you decide to take that risk? I know it's a hard question.
It is a hard question. I've always been pretty confident in my abilities. It's just when you go into a different level of I guess when you're exposing yourself to be judged or not do as well. And so I think it's just, you put yourself in that position and you do as well as you can, and then you start seeing other people maybe that you thought were really smart. There were a couple people in my medical school class that I was like, oh God, that person's the smartest one. they didn't make it.
Wow.
And so,
Wow.
appearances can be deceiving,
Yeah.
and so I think as long as you know that you have the abilities and you're capable and you're driven, if it's what you really want, you'll make it happen.
Okay.
And I'll say the most important thing, backtracking too,
Yes.
before going to medical school, you have to network. You have to meet every single person in the hospital, in anything. Introduce yourself. Tell them where you're from. Tell them what your goals and ambitions are. And people really want to help you. If this is what you want to do, they will help you. They will provide people. They will provide recommendation letters. They will, provide numbers. They will do whatever they can.
That's really good advice. Really good. Okay. So this is a question I get all the time from emails and people leaving comments on these videos and on my blog. So many people want to know, do you think nursing is a good kind of pre-med major or a good stepping stone to medical school? If someone's ultimate goal is medical school and they think, I want to be a nurse for a couple years to make some money or for the experience and the knowledge, would you recommend that path?
Overall, I would say I definitely would recommend nursing school because of many reasons. You aren't set to just go to medical school. It's not like a pre-med major that what are you going to do when you graduate? Are you going to be able to use that degree if you decide not to go to medical school?
Right, yeah.
Whereas with nursing, you will have a job. You will have a good paying job with healthcare and great hours with vacation time. So I don't know. There was one girl that was a year ahead of me in my medical school class. She went straight through nursing and then applied to medical school. So she never really even worked. I don't know that I would recommend that because
just seems like a long way and a lot of work and unnecessary.
It's just different.
I don't
not
know.
Giving you. I don't know that I would do that because number one, nurses are very passionate people. They're very protective of their profession as well as their patients.
Mm-hmm.
And so when they see that your ultimate goal is not really to be a nurse,
right,
you won't get the best responses from them. And I had a lot of issues with that when I was a nurse and trying to go to school.
Wow.
It was surprising.
Wow.
So I would recommend, I think nursing school is great. It definitely exposes you to healthcare, exposes you to patient care and the frustrations that not only go with,
right,
a job, but also the system, the insurance problems, the patient problems, just everything.
Yes.
So it'll expose you to that, but I don't think you could ever understand what it's like to be a physician until you're here.
Yes.
And I don't think I thought I knew what I was getting into, but I didn't.
Really?
So,
even though you had seen the doctors and worked with them, and
I had no idea the sacrifices that they made in order to be where they are.
wow.
It's not your choice. It's your family's choice. You're not only going to be a medical student and then a resident. Your parents are going to have to deal with not really having you around to come have the barbecues or 4th of July's or Christmas and all these things. And it's almost like it's your parents are going to lose you. You're not going to be the best brother, sister, or husband, wife. It really takes a lot of you in order to dedicate yourself to learning medicine.
That's so true. We both miss Christmas this year,
Yeah,
right?
exactly.
No Christmas.
Yes. And then, residency, you end up moving away. You don't know where you're going. It's
Right.
just a lot. But overall, I would definitely recommend nursing. It is a good way in order to determine if you want to go to medical school. And then also, you can work for a few years if you don't get in immediately. You can also do a master's program in nursing. And so I guess you really have to determine what's important for you. For me, I set this goal because I love to learn, and I thought that medical school would be the best way for me to understand the human body, and so I could help my patients the best way possible. And so that's why I went with medicine. Now looking back and seeing all the other nurses and nurse practitioners who have great jobs,
Yes.
weekends off, no call, and the overall responsibility is still on the doctors.
Yeah.
They have it really good.
Yeah.
It's less, a master's program is 2 to 3 years, but they're requiring a doctorate now, which I think that's all programs are going to that. So it might be 3 years now, but still it's overall less cost, less time, overall better quality of life.
Yes.
You may not be the one that's making all the decisions or has all the knowledge, but you still get to make a big difference in patient care and still have a work-balanced life.
Mm-hmm.
Work-life balance. So anyways.
So true. So true. I did a PA video, and we talked about that too, how you really get all the benefits, and you don't have to do all the crappy stuff we have to do as residents.
Right. Right. Yes.
Yeah.
And then, so, I mean, right now I'm making around $15,000 less a year as a resident, and I work 3 nights a week, and so here working around 60 to 80 hours.
Oh my gosh.
So, I mean, there is a setback. You are sacrificing making money every year to then go into med school and not make money.
Right.
It's a lot to really think about. So
that's a lot. All right, last question. What is your advice for anyone who's pre-nursing or pre-med? What do you wish you would have known? Would you have changed anything? What do you want to tell all of YouTube?
Okay. There's a lot that I could tell you, but again, I think that networking is the most important thing you can do. Yes, set your goals, really evaluate it, make sure that that's what you want to do. And, again, no one can really understand or appreciate what physicians go through until they're here. But networking is really what got me into medicine. Just putting yourself out there, and don't hesitate to ask, for help or avenues to get through things. I think that's the best thing you would be harming yourself by not asking for people's advice and assistance, because physicians. That's one thing that I really love about physicians is they really are willing to help each other. Yes. It is very collegiate. Yes. It is very. They don't hesitate to help you. And with nursing, I didn't always feel that way, and it can be not as, I don't know,
a little more
supportive in a way. Physicians really stick out, cover each other, I guess you could say.
That's interesting. And that's something, only you would know from seeing it from both sides.
And one thing I will say is when I went to nursing school, it's question the doctors. Make sure the doctors know what they're doing. And in medical school, it's appreciate your nurses. Don't ever disrespect the nurses. They know what they're doing. So I think that there's always the discrepancy that it's either or, you have to be on this side of medicine or this side. It doesn't have to be that way. There's no line. Or whatever route you take, just always respect the other field.
That's so good. Well, thank you so much. That was just wonderful. I mean, I think you just gave us so much great information. So I hope you all like this video. Subscribe so that you never miss any more videos. And don't forget to check out my blog, AndreaTooley.com. If you have any questions, leave them below or shoot me an email, Instagram or Twitter, and we'll talk to you later. Bye.